Okay, we'll go ahead and get started. Welcome. This is Rich Wickland. I'm the CEO of BenefitsApp. We're going to be discussing contact tracing today as a feature and function of the BenefitsApp. It's a topic of interest for many people. I see a lot of the folks on the webinar who have joined are folks we know, plus a few new people, so welcome. We're going to talk about contact tracing in the news, the impact that we feel it will have on human resource teams as they try to get their staff back to work effectively and safely. And then we'll give you a quick demo of our contact tracing feature within BenefitsApp. If there are any questions, please go ahead and put them in the chat feature. Nancy McCarthy, who's our VP of Operations, is monitoring that. And she will share questions with me towards the end that we will do our best to answer, or we will respond back to you. With all of our webinars, you can go to BenefitsApp.com to view our resources page, where there will be a recording of this posted probably early next week after the holiday weekend. At BenefitsApp, we've really put together a toolkit. We see this as a complete circle here, circle of life, so to speak. We want you to be able to connect with your employees, survey them in an effective, easy way, have them agree to certain policy documents, analyze their response, have effective contact tracing, and then the options for advocacy or telehealth. And so we'll be getting into that as we go through the presentation. BenefitsApp, we feel benefits made mobile or benefits made easy. The BenefitsApp bridges a communication gap between open enrollment and when employees need benefit information throughout the year. As COVID-19 has come upon us this year, we have developed within the BenefitsApp a health screening tool, a digital signature tool, and a comprehensive contact tracing for a healthier workplace. At BenefitsApp, we feel contact tracing is going to be the most important aspect of getting folks back to work and keeping them healthy at work and making them feel secure when they're at work. And so we're excited to show you our approach to contact tracing within the app. Initially, we're going to start off with talking about contact tracing in the news. This is a hot topic. There are articles from SHRM, from Forbes, from Becker Health IT. And so we want to share with you some brief snippets that we have found online that have been published within the last week to 2 weeks. So Eagle Hill Consulting out of Arlington, I think they're up in Boston as well. They've done a nationwide poll, and they have found that 54% of U.S. employees say they're worried about exposure to COVID-19 at their job. People that are worried, it's challenging if you're worried to go to work. Some of the factors that they say will make them feel safe is obviously access to protective gear, mask, gloves, hand sanitizer, mandating that employees with symptoms stay at home, and making COVID-19 tests available. Though we can't help with the PPE, we can support human resource teams insofar as understanding the wellness and the health and wellness of their employees, as well as through our partnerships with companies like MeMD, make COVID-19 testing available to employees. 56% say employers have the right to know if workers have tested positive for COVID-19. An issue of this is, how do you make that connection? How do you communicate, stay in touch with employees effectively when they get tested and find out if they're positive or they're negative? SHRM recently published an article about contact tracing for employers. In a worksite investigation, they basically say, look, contact tracing is a narrower version of contact tracing that public health officials are gearing up to do. This is a massive project. And for human resource officers, we feel that there's a need for an easy to deploy, effective way to do contact tracing. And the BenefitsApp platform supports that. You need to be prepared. A lot of preparations around communications, setting policies, and making those policies available to all employees. Again, with a remote workforce, we feel that connecting to employees through a mobile app like the BenefitsApp is an easy and effective way to communicate, engage, and notify employees of company policies. Within the BenefitsApp, in the demonstration, we'll show you that we have a sample COVID-19 policy and a digital signature tool that allows employees to sign that they've read that policy, allows you to cover that base in your strategy. You must prioritize confidentiality. Employers do have the right to ask if employees have symptoms or being diagnosed with COVID-19. But at the same time, you need to make sure you never divulge the name of an infected employee. PHI is important. Everything must be HIPAA compliant. BenefitsApp is based on the Salesforce.com Lightning platform. It's HIPAA compliant. It's SOC 1, SOC 2 compliant. Our staff is all HIPAA certified. And so confidentiality is a priority for us, and we make that easy for you. Further, SHRM says that you should consider apps and follow up with employees. So BenefitsApp allows you to deploy a strategy for contact tracing, but also makes it easy insofar as following up with infected employees, but those that have had close contact. And we'll show you how we have automated email alerts to employees that have come into close contact with others that have COVID-19 symptoms or have been diagnosed. Becker Health IT also said that had an article about New York City has tapped Salesforce.com to build a COVID-19 contact tracing program. This is a big effort with Salesforce, between Salesforce and New York City. BenefitsApp is based on the Salesforce Lightning platform. Our offering is the same offering that Salesforce is offering to New York City, and we'll demonstrate that to you in a little bit later in this presentation. So how do you manage this? We've spoken about keeping in touch, understanding the health and wellness of remote employees as they're home, helping employees get back to work, making them feel safe, giving them assurances that they will be safe if they're at work, and then following up and keeping track of people that have been in touch with those that have been infected. These are challenging things, especially in a remote, as we have a remote workforce. So the BenefitsApp is a platform that's easy to use, easy to deploy. It's a mobile app. It's a toolkit that supports you and your strategies for getting your employees back to work. For those that are new to BenefitsApp, we've got a couple slides here that just speak about the user experience. You download the BenefitsApp right off of the app stores. You go to Google Play or Apple App Store. Anyone can download BenefitsApp by searching for BenefitsApp. You have secure access. When you download the app, you register, and you register with your company code. So it might be X Corporation, and a user ID. So we will typically get a census from your HR team or from your human resource, your broker. Employees register with their company code and with their employee ID. They are then presented with a custom view of the BenefitsApp that's customized to their company and to them. They have access to quick links, benefits, other benefits related information. They can then dial in to see benefit information as well as their profile. For the COVID-19 strategy, we have the ability to send out push reminders to fill out a COVID-19 survey. We have many recorded webinars on this on our website if you'd like to see that in detail. You can take the survey. It's a survey based on CDC survey questions. When you take the survey, you then result in a green, yellow, or red status. Green means you're good to go. Yellow means monitor your symptoms. Red means that you should stay at home for either 3 or 14 days. The questions, the survey, and the responses are all configurable to each company's requirements. Further, we have a digital signature tool that we'll demonstrate to you that allows you to present a company policy as the SHRM's recommended, and have people sign off that in fact they've read and understand that policy, just to cover that base for future coverage against liability. Every BenefitsApp client gets an HR portal license, and what that allows them to do is get into the understand how employers are responding to employee COVID-19 surveys, and allows you to effectively do contact tracing. And that will be the focus of the rest of the presentation today. BenefitsApp allows you to bridge the communication gap. That's the connect in this circle. So you're able to connect with employees. Employees use their phone all day long. We are building a relationship with employees with their phone, with the BenefitsApp, because it's an easy place to get access to all the employer-sponsored benefits that are given to your employees. So BenefitsApp allows you to connect with employees. We have the ability to do highly targeted, highly segmented push notifications and in-app messages. So in the process, every morning or once a week, you'll get a push message that says, please complete today's health survey. When they click on that, they get to see their survey. So this is the survey aspect of the circle where you go in and you can take your CDC-based survey, You can also see instructions for whether you're green, yellow, or red status. Next, we have in the circle policy agreement. So we offer a digital signature tool that allows you to ask employees to read a policy and sign that they have received and understood that. In the back end, you get access to a human resource portal that allows you to see all of your employees, whether they've taken the survey or not, number of infected employees, as well as contact tracing among your employees. We're going to demonstrate that to you live in a few minutes. Then further, we have a health within the process for contact tracing. When you log into the portal, you get to go in and see each members or each employee's survey results and whether they have a green, yellow, or red status. You get to see their survey questions that they've answered, and then have follow-up questions based on the CDC recommendations, date of testing, if they have results, if they've been hospitalized, etc. Further, there's the contact tracing. So if someone, in this example, John Doe, has been in contact with Alvin or Nancy, we're able to track that within the back-end system and alert those employees to the fact that they've been in close contact. So relationship tracking tracks the infected employee, the person they've been in touch with, the relationship to that person, when, where, and for how long they were in close contact. You get to see this in a visual way within the system. And then as anyone is identified as having close contact, we send out a triggered email of that COVID-19 close contact alert. So as close contacts are identified within the system and you hit save, an alert goes out to that employee with an explanation that they have been in touch with someone with COVID-19, when, where, and for how long, and then managing expectations. We give them advice based on CDC recommendations on what to do next. The last part of the wheel is that if someone is infected or there's a close contact, we have relationships with two companies, partnerships. One's TouchCare, one's MeMD. Both are able to act as a health advocate and also prescribe through MeMD, can prescribe COVID-19 testing. They just this week announced that they can now prescribe in-home COVID-19 testing based on an FDA-approved in-home testing kit. So that's very exciting, and we'll be having a webinar with them coming up either next week or the week after regarding that. So now I'd like to jump out of the PowerPoint and give you a demonstration of how this works. Again, if there are any questions, please submit them by the chat window, and we will be answering those at the end of the presentation. You should now be able to see my phone, and you see BenefitsApp as a bright icon on the screen. When you launch BenefitsApp, I'm going to cover up the camera so that I can show you every employee that starts with BenefitsApp downloads it from the app stores and they'll register. It's a very easy, quick registration. They put in their email address, their chosen password, company code, and their member ID based on their census. Typically, that might be last name and the last four of a social security number, and their cell phone, their texted code, and then they're able to log in. It's got two-factor authentication, which speaks to HIPAA compliance, security, and confidentiality. Once they're registered, they can click on the icon. It will face recognize them into the system, and they'll have access to BenefitsApp. At a high level, BenefitsApp gives you access to all your benefits, your employer-sponsored benefits information. If you have other eligible members, other family members, they are listed at the bottom here. I'm registered as John Doe. John Doe has a relationship with Rich Wickland. As I scroll up here, fundamentally, BenefitsApp allows you access to your benefit information as typically provided by your broker. We take that information and we can break it down into its components so that your employees always know what benefits they have available to them from the company. If you have a specific COVID-19 benefit, that can be displayed here. Within the system, we have our COVID-19 toolkit. We have instructions on how to use the survey. We also have instructions as to if you are rated green, yellow, or red. Some might say for yellow, stay at home, continue to work from home. Others may say, please come to the office to be evaluated at the front door. So these can be modified per your needs. The health survey is a survey based on the CDC where we ask questions. Have you been infected with COVID-19? Do you have a fever? So these are questions that we ask, again, based on CDC recommendations. These questions can be changed per client. I'm just going to go through here and hit yes for everything, and I'll hit submit. BenefitsApp then evaluates you and says, okay, you are a red level 4. If I go back to COVID-19, I could see red level 4 says, please remain at home for 14 days. This is all about managing expectations and help people understand what they should do if they have COVID-19 symptoms. Further, within that COVID-19 toolkit, we have our policy acknowledgement, which again is for managing communications, managing expectations, as well as conveying a policy to your employees in which they can sign off on. This is based on our integration with a product called HelloSign. HelloSign, DocuSign, AuthentiSign, they're all the same thing, where you present a template. This is your COVID-19 policy document. I can go in here, I could sign my name to it. I can add in my name at the bottom, hit continue, and agree that I have read the policy document. That signed PDF is available to you within the human resource portal. So that's the COVID-19 toolkit. Jumping into the back end for the human resource officer, you get to log into our HR portal. Here you get to see total number of employees. This employer group has 58. We have some clients with as many as tens of thousands of employees, and whether or not they have filled out the survey or not. I have a contact tracing donut here. I'll get to that in a minute. But I can also see my surveys over time, and I could look at the report of my 2 employees that have registered as a red survey, which means they have some level of infection. So I can go into John Doe, who's my employee. I can look at their most recent survey. Now, John Doe has an L4, so he's been asked to stay at home for 14 days. That means he will not get a push notification for another 14 days. Everyone else will get one every day or per the requirements of the company. You could see how John has responded to the survey questions, and then you could go in here and follow up with each employee to find out when did the symptoms come on, what were their symptoms. These are, again, CDC driven recommendations. If they've been tested, what are their results, and maintain all this information about this employee. Once you did that, you can also ask John Doe if he's been in touch with anybody. So you'll see here, John has been in touch with Alvin. So this is an example of contact tracing. This is going to be the hard work that's going to have to be done this year as people get back to work, and it's an efficient, effective way to do it. So John has been in touch with Alvin. We have 2 check boxes: send a close contact email and agree to share information. So you may say yes, no, or it's company approved or company mandated. You can make a brief description of the contact, but importantly, you can say the name of the meeting, the location, specific area, the date, the time, and the duration. When I hit save, Alvin is going to receive an email that says a close contact has occurred that he needs to be aware of. And this is what that close contact email template is. Dear Rich Wickland, or in this case, it'd be Dear Alvin, you have been in close contact in this location, this room, this time, and for this duration. And just be aware, and this is what you should do going forward. So that email is automated. It's automated as soon as you hit save, and then it is also sent 3 days later and 5 days after that to follow on with that employee. It's a great Forbes article that talks about how important it is to stay in touch with people once they've had that close contact. It's very easy to add in additional close contacts by cloning the last one and just changing the name of the next employee if it was a group within a meeting. I could further then go to John Doe and look at the relationship viewer. This gives you a visual of who John's been in touch with. So we know John has been in touch with Nancy and Rich and Alvin. So if I go to Alvin, I could see that Alvin has been in touch with Rich Wickland. So it starts to expand as you go through and use the system. And in this regard, you can click through and see each person and go in, look at their latest surveys, as well as their relationships and who they've been in touch with. And in that way, you can continue to work through the process of managing your close contact and contact tracing. This is the same platform, again, that Salesforce has sold to the state of New York. It's a relationship management object, and we're happy to be able to provide this to our clients as well. So within the system, you've got, I'm going to go back to my PowerPoint. We're supporting human resource teams insofar as connecting and forming a mobile relationship with their employees through the Benefits app. It's easy to download off the Benefits off of the app stores. We make that relationship with employees by offering them easy to use access to their employer sponsored benefits. An employee can download and use the app. Any eligible member within that employee's family can also download and use the app. We have the health survey that's CDC based. The survey allows employees to let you know if they're healthy or not. It's a very effective way for understanding the health of your employee groups. Once you understand that, you also have the ability to present them and communicate with them your policies and get them to agree to those policies with their digital signature in the back end in the Human Resource Officer portal. You can analyze that information, understand who is having, who may be at risk, call them and follow up. We can make this available to you as a human resource officer or to your third-party health advocate team if you have one. We currently have a relationship with TouchCare that can do this for you. They can interview the employee, understand who they've been in close contact with, enter that into the system. It automates emails to those that have been in close contact at the moment, and then 3 days later and 5 days later, and then again can be passed off to an advocate or telehealth organization. Our partner, MeMD, can reach out to the employee, or the employee can reach out to MeMD through the app and request a COVID-19 health antibody check, either through Quest or LabCorp, or as I said, they've just announced an in-home COVID-19 test that's FDA approved that they are launching. So it's really a circle that continues to go around, and we feel it's going to be a very important part of what the human resource team has to do going into this this fall, and really for the next, I believe, 18 to 24 months. If anyone has any questions, please submit them by the chat window. We'll attempt to answer them. Some of the questions people ask is, do we have to have a full benefits app with all your benefits information, or can we just start with the survey and contact tracing? You could definitely start with just the survey and contact tracing, and then add your benefits information as you go into open enrollment or whatever time that you wish. We work with you on the deployment. The system is multilingual, so in the human resource portal as well as the app, you can choose your language, and the app will change to that language. When we send out our push notifications, the push notifications are set to both the local time zone of the phone as well as the local language of the phone. And so everything is tuned to the individual. At BenefitsApp, we offer full service. We typically can work with you directly as a human, with your human resource team. We often work with leading brokers, benefits brokers throughout the country. And so we're happy to work with you in any way you want. We offer full service. We do this every day. It's easy for us. So we just, anything that you need within the Benefits app, we deploy for you, and you have a assigned engagement manager to support you. Further, the deployment's fairly quick. Typically, a Benefits app can be deployed within 1 to 2 weeks. That deployment is typically based on receiving a census file. That seems to be the slowest part of the process. So I want to open it up to questions before we finish up here. It seems that one question is about Salesforce in New York. So Salesforce.com is a leading customer relationship management platform. You can Google it and find out more about Salesforce.com. BenefitsApp is based on the Salesforce Lightning platform. That shouldn't mean a whole lot to everybody, but what it means to us is that our platform, our product is hosted from a global platform that's highly secure. It's a multi-billion-dollar company, highly secure, highly available, highly scalable. It's fast, easy to use. And so the fact that we're able to offer you the same thing that Salesforce.com is offering New York City is a pretty neat thing. Our relationship is that we host our product on that platform, and we're able to deploy this for our clients in a 1 to 2 week window. Looks like Nancy, another question.
I have a couple questions. One is, can you communicate through the app for different classes of employees? And also, how often can we send the push messaging?
Okay, great question. So the BenefitsApp interface, when we work with a client that provides us a census, within the census, there's typically a groupings of individuals within a company. So you might have groupings can be by region. They can also be by level within a company. So employees might be a senior level, a salaried level, an hourly level. And so the BenefitsApp is specifically tailored to those that might get life insurance, see an interface with life insurance. Those that only get medical, only see medical. So the app is configured specifically to that, to those by region and by level. Further, with our push notification system, we can send push notifications specifically to every employee within a group. We can send it to groups of employees. We could send it by region, and then we can segment it right down to the individual. Ultimately, our strategy here is that we're building a relationship with employees to form, to connect employers to employees and allow them to communicate at an individual level. And so ultimately, we are on our roadmap is working with business intelligence systems to identify risk populations and be able to send targeted messaging to different risk populations in order to affect a healthier workforce. With COVID-19, we're able to do that as well, again, targeting people by region and by level. Nancy, was there another question that you had?
Yeah, another question, is this GDPR compliant?
GDPR, that's a great one. Good question. So for those of you that are not familiar with GDPR, it is, in the simplest sense, it's the right to be forgotten. And so you have the right to request, in particular in marketing instances, the right to have all of your data be removed from the system, any system that may have your digital information. Typically that relates to marketing insofar as it's a good question related to employees and health benefits and employer records. Our system is GDPR compliant. And so as an employer, if you request an employee's records to be expunged from our system, that is something that we are able to do. Yes, so it is GDPR compliant. I would have to look to see if how that relates to employer records. That's more of a legal question. I'm not a lawyer, but that's something that we can take a look at and maybe add to our website. So good question. Again, typically more related to marketing, but if whoever asked the question has a follow-on, I'd be happy to maybe take another swing at that answer.
Another question, once we return to normal and we don't have COVID support and want to maintain a remote work environment, can you support benefits, enrollment, and communications?
Yes, so the system is very flexible. The nice thing about BenefitsApp is it's always up to date. So as plans change or you add benefits to your, for employer-sponsored benefits to your program, the BenefitsApp is always up to date. Let's say you add a benefit mid-year, you can add it to BenefitsApp. We can send a push notification or an in-app message that highlights that benefit. And so an example of that might be that as BenefitsApp this summer will be integrating with over 300 wearables. Let's say that you put together a benefit that if your employees meet a certain number of steps per month, we'll be able to convey that information from a Fitbit through BenefitsApp through to the human resource portal. So let's say you roll that out. You can then add that to BenefitsApp. You can send a push notification to your employees and they will get that right to their phone. So yes, you can use this post-pandemic. It will support your communications effort. It will be the one source of truth for benefits for your employees. And not only your employees, but any eligible member. So that would include significant others, potentially children of a certain age. And then I think one more aspect to that question was open enrollment. We can definitely open up a window within BenefitsApp for open enrollment. And it's just simply the preference will be the preference of the end user as to whether they want to do open enrollment through a phone interface versus a browser interface on their computer where they may have more room. There's so many different open enrollment systems that we can connect to any of them through essentially opening a window to it. But again, that's probably more of a user preference than anything. Nancy, was there another question?
Another question, I missed part of this presentation. Can I find a recording of it on the website or online?
Yes, so we will take this is being recorded and it will be posted on our website early next week. We typically, I always say a lot, so we like to it and then we'll post it to the website for your viewing. We will send out an email to everybody so that they can watch this as well. So I want to be respectful of time. We like to get these things done within 30 to 40 minutes. So our future roadmap, we will have urgent care built into BenefitsApp. We anticipate by the end of the summer. That's with our partner MeMD. It will be urgent care, which would be you can speak with a doctor and they can prescribe medicine to you in your local. It will also be behavioral therapy, talk therapy. Further, we're going to be integrating through a wearables API with over 300 wearables. That would be your Fitbits, your iWatches, your Garmins, the things that people wear when they exercise. And so they will be able to attach those wearables to BenefitsApp and then say, add my steps or add my heart rate or whatever you want to BenefitsApp, and that information will convey right through to the human resource portal. Again, the use case there is that if you have a benefit for people that like to do steps, track their steps, we will be able to facilitate getting that information from the wearable through BenefitsApp to the human resource portal where it can be actionable. Further, this fall, we will be implementing an integration with Epic. Epic is what drives MyChart. So if there's certain codes that you want to track, so for instance, in our mind, if you would like to, if your doctor, if an employee goes in and gets a COVID-19 test, and that information is either in MyChart or in a lab account like a Quest or a LabCorp, we will be able to activate that within BenefitsApp and allow the employee at their discretion to allow you access to that information. We feel that, again, communication, surveying, policy management, and then as we get into the next 6 to 12, 18 months, creating those channels for employees to let you know that they are healthy and available to come back to work, either in a self-reporting or a clinical way, is going to be important, at least until we get some sort of any sort of progress on combating COVID-19. So I want to thank everybody for their participation today. This will be posted on our website early next week, probably by Tuesday, and we will send an email out to everybody making them aware of this. If you would like more information about BenefitsApp, we've got a great website, BenefitsApp.com. Please reach out to your broker, ask them to reach out to us. And if you have any specific questions, you can always email us at sales@benefitsapp.com or myself, rwickland@benefitsapp.com. So with that, thank you very much for your participation, and we hope everyone has a safe and fun 4th of July weekend.